Welcome to this month's Nutrition Pearl, Navigating the Formula Recall, presented by the Council for Pediatric Nutrition Professionals. This Pearl focuses on practical strategies for helping your patients following the February 22 formula recall and resultant enteral and infant formula shortages. Patients unable to access their typical formula or an appropriate alternative are at risk for many acute and long-term negative health outcomes, especially patients with severe food allergies, malabsorptive conditions, or metabolic disorders. For patients on free amino acid formulas, infant products can be used for children when necessary, but the reverse substitution typically should not be made. Given the poor availability of elemental formulas, consider whether your patient may be a candidate for a more intact formula, like a peptide versus a plant-based or food-based formula. Each patient case should be individually evaluated and best clinical judgment used to determine when this is a safe change. Food-based formulas are not appropriate for infants. Please visit NASPGHAN's website for a table of recalled formulas and their appropriate substitutions. Home infusion companies currently have rapidly changing stock of specialty formulas. It's imperative to return any requested paperwork promptly or the desired product may no longer be available. Adding a clause to your patient's formula prescription stating appropriate substitutes allowed may reduce requests for new paperwork, but it's not allowed by all state Medicaid plans and should not be used in the instance of non-standard mixing, since substitute products will alter the recipe. Consult your dietitian for recommendations and recipes. Providers can anticipate many questions from caregivers who are anxious about maintaining their supply or may be out of formula. Strongly discourage homemade formulas, nutritionally incompatible substitutes, use of expired product, or dilution of formula, as these all pose major safety risks. Also caution caregivers in purchasing product from overseas that may not be tested for purity and safety, or such products should be obtained from a reputable and traceable seller. Encourage caregivers to maintain open communication with their medical team about the challenges they are facing. If you are contacted by a patient or family who is out of formula, these are some places you can direct them. Thank you for your time. Please feel free to reach out with any questions.